I'll be talking about arthroscopy and what we call as meniscal tears. What is arthroscopy? Arthroscopy is a simple procedure where we put a small scope. Our scope diameter is 4 millimeters. We put that scope into the knee, into the joint, and we are able to visualize the entire inside of the joint very beautifully. The main advantage of arthroscopy is the ability to see the inside of the joint, every nook and corner of the joint, so gives wonderful access. There are other advantages, like it's a minimally invasive procedure. You've got cuts which are about half centimeter on the skin and the blood loss is very minimal. But as I said, the main advantage is the ability to view the entire inside of the joint. What is a meniscus? Meniscus is a shock absorber which is there in the knee joint. We have the thigh bone and the leg bone, and you've got shock absorbers in the joint which act like cushion. Whenever there is loading of the joint, these shock absorbers act as a cushion. There are two shock absorbers on either side like a C kind of structure. The meniscus may tear in the younger individuals because of a sporting injury, a twisting injury, and sometimes in the middle age and elderly because of degenerative changes in the meniscus. When the meniscal tears happen, they end up causing pain. You might have a sensation of locking or catching inside the knee joint. Now, the management of a meniscal tear depends on the region of the tear, the extent of the tear. Sometimes can be managed with exercises, physiotherapy, and sometimes might need a surgery, what we call as arthroscopy, where we put in our arthroscope, look at the inside of the joint, and then decide what is the extent of the tear. And sometimes if it is degenerative tears, we trim the meniscus, balance the meniscus, and sometimes if it is a good younger individual, we repair the meniscus. These days, earlier everybody used to remove most of the meniscus, but now most of the times we end up trying to conserve the meniscus. We do a meniscal repair because the shock absorber is necessary for your joint so that it does not lead to arthritis in the long run. If you have a good shock absorber where the load on the bones is reduced, then the chances of arthritis gets reduced. So don't neglect your meniscal injuries. Get it checked by your surgeon and get it treated. If it is surgery, it is an arthroscopy, or else it is just with physiotherapy and rehab. Thank you.